Hi and welcome. Today we're covering something every parent of a child with CTNNB1 syndrome needs to understand. Why sleep and behavior challenges are so common, what the science tells us about them, how treatments and natural approaches can help, and even a big scientific conference coming up where families and experts will share advances. Let's start with why sleep can be difficult in CTNNB1 syndrome. The brain controls sleep through networks that regulate arousal, body temperature, hormones like melatonin, and circadian rhythms. In children with neurodevelopmental conditions like CTNNB1, these networks can be disrupted. That doesn't mean sleep problems are just behavioral. They have a neurological basis. Poor sleep can show up as trouble falling asleep, frequent waking, early morning waking, or restless sleep. Over time, lack of sleep impacts mood, learning, memory, attention, and physical health. Research shows that children with developmental differences often have atypical melatonin production or signaling issues in the brain's sleep centers. Clinicians sometimes assess melatonin levels or suggest a melatonin supplement under medical supervision to help regulate sleep onset, but it's not a one-size-fits-all solution. Other medications sometimes used always with a pediatrician or neurologist include low-dose clonidine or low-dose trazodone for sleep regulation in specific cases, and in some situations, sleep phase stabilizers. These are prescribed based on individual sleep patterns, age, weight, and other medical considerations. Behavior challenges in CTNNB1 syndrome often relate to communication barriers, sensory processing differences, and neurological regulation. When a child can't express discomfort, pain, or needs clearly, frustration can manifest as behavior that looks oppositional but is really communication. Science tells us that behavior is a form of communication. Instead of asking, "Why is my child misbehaving?" clinicians often ask, "What is the child trying to tell us?" Is it sensory overload? Is it tiredness? Is it hunger or discomfort? Identifying the cause helps tailor support. When behavior is consistent and intense, professionals may sometimes consider medications, like low-dose risperidone or aripiprazole to help with severe irritability or self-injurious behavior, always with careful monitoring. Other drugs, such as anxiety medications or ADHD-focused treatments, may be considered if clinically indicated. All of these decisions require careful discussion with your doctor because medication responses vary from child to child. Natural approaches that are well supported by evidence for sleep and behavior focus on structure, routine, sensory support, and environmental cues. For sleep, this includes a consistent bedtime routine, fixed wake times, dim lighting in the evening, reduced screen time before bed, white noise or low background sound for some children, and weighted blankets if recommended by an occupational therapist. These environmental changes help signal to the brain that it's time to sleep. For behavior, sensory diets designed by occupational therapists, which may include firm touch, proprioceptive input, or deep pressure activities, help children regulate their nervous systems. Movement breaks throughout the day. Jumping, climbing, swinging are not play alone, but neurological regulatory tools that help the brain stay organized. It's also important to work with speech and language therapists to build communication tools, whether that's sign, picture exchange systems, or alternative communication devices. So behavior is less about frustration and more about expression. Now, a very exciting development for families worldwide is that the fourth International CTNNB1 Syndrome Conference will take place on June 18th and 19th, 2026, in Barcelona, Spain at the Hotel SB Diagonal 0 Barcelona. This two-day event brings together leading experts, clinicians, researchers, and families to share new data, connect with others, and learn about upcoming clinical trials and care strategies. Many families attend to gain insight into real emerging research, including preliminary clinical trial results and global care networks. If you're interested in attending, registration information is available on the CTNNB1 Foundation website and early registration can help you secure places in key sessions and family-focused programming. Finally, it's absolutely okay to feel overwhelmed by sleep struggles or behavior issues. You're not alone, and these challenges don't reflect poor parenting. They reflect a complex neurological condition that requires informed strategies. The most effective support always combines medical guidance, structured routines, sensory supports, communication access, and, when appropriate, medication under clinical supervision. If this video helped you understand sleep and behavior in CTNNB1 a little better, please like, share, and subscribe. It helps this channel reach other parents who might be feeling exactly as you do right now.